Good morning. My name is Mike Coolman. I'm going into pre-engineering. Our question for the day is, what are some leading causes of high death rates for Indigenous people?
Okay, my name is Laura Herman. I'm going into sustainable agriculture and food systems, and my topic is about suicide rates.
My name is Sadie Eagle. I am going to Social Human Services, and my topic is about psychosocial influences on death rates.
My name is Brian Rier. I'm in General Studies. My topic is injury morality on Native Americans.
My name is Peasy, and my topic is the homicide of Native children.
And these are some of the definitions of keywords in the question.
Causes to be the cause of, bring about.
I is a significant above average.
Death rates, also often referred to as mortality rates, is the relative frequency of deaths in a specific population during a specified time.
Indigenous, relating to or being a people who are the original, earliest known inhabitants of a region, or are their descendants. I'm the first participant, psychosocial influence on death rates. As said in the article, the current health and social conditions are coupled with continued discrimination that act as a reminder and continuation of historical traumas that persist throughout the lives of Native people. American Indians undergo various types of health inequities, which means unfair health circumstances are proceeding, as well as health inequalities that indicate unequal health opportunities and treatment, both of which cause an immense amount of death. A lot of these factors amongst Native Americans stem from unhealed generational traumatic events that go hand in hand with the overall physical health of the body, as well as psychological problems. Most of our mental health affects our overall health. These issues originate from the very beginning of mass destruction and decolonizations of Native Americans, which began in the late 15th century. Diabetes, cancers, addictions, and suicide are just a few examples of disparities that occur and what they undergo in order to obtain proper treatment and care. It affects a lot of Indigenous people till this day, especially the next generation who are in danger of exposure due to a repetitive cycle of psychosocial influences. Overall, the health of the mind, body, and soul is in jeopardy of dying in Native country due to past, present, and future psychosocial influences. Thank you.
My topic is suicide rates. In the article, Perspective on Suicide Prevention Among American Indian and Alaska Native Children and Adolescents, A Call for Help by Gary. The article explains that suicide among AN youth is at an all-time high. The risk factors are depression, low self-esteem, family instability, strained interpersonal relationships, alcohol, and substance abuse. There is a history of mental health problems, feeling isolation from their families and communities, having a friend that attempted suicide, history of family members attempting suicide, weekly liquor consumption, a family history of physical and violence, sexual abuse, exposure, especially among the females. It was clear that in 1989 and 1998, the suicide rates for AIN youth were greater than the Caucasian and Black youth. Both male and female suicide rates increased over the decade and was 3 times greater than their Caucasian and Black counterparts. The highest suicide rates were in Tucson, Arizona, Aberdeen, and the Alaska areas. These regions were described to be in Indian country according to the Indian Health Services. AIN youth also live in some of the poorest communities, have the lowest educational attainments, and live in massive pockets of poverty while being surrounded by wealth and privilege. Many AIN youth have few resources and cannot purchase the necessary goods and services.
Thank you.
Injury morality on Native Americans plays a major morality on Native Americans and misuse of alcohol. In this article, here for this day, shows the development of what age misuse starts. Between the age 10 to 15 is when alcohol misuse starts. The rate increase double each year on males and females. National knows at early age it soon create disorderly behavior and mental health. The age between 11 to 13 will have a 5 times greater risk of misuse. Over half, 58% suffer a mental disorder throughout their lifetime. 37% 2 or more during their childhood. Boys were more likely to meet major depressive disorder, 30% for males. Female rates were 12%. Thank you.
The article, The Sweet News About Diabetes, states that according to research, 50 years ago, diabetes was rare among the Native American people. Now, the CDC believes that the death rate for Native Americans, Alaskan Natives, is 4.3 times higher than that of the general public. But it has been shown that the disease is controllable and preventable with lifestyle changes. There was a study done at 6 North Dakota tribal colleges, and in that study it was found that 40% of students had immediate family that had been diagnosed with diabetes. Also, 60% of those surveyed admitted that they were too heavy themselves. Now those colleges are being funded through the American Indian Higher Education Consortium initiative, along with the CDC's National Diabetes Prevention Center. But each college is designing a program that is tailored to its local needs. An example was given of the Fort Peck tribe. They worked with school-aged children and designed a play about why diabetes was bad. That play was then broadcasted over the local television station. The article also states that the National Institute of Health is currently working with 8 tribal colleges to help establish a science-based diabetes curriculum that is based towards teaching K through 12 students about science as a career as they learn more about diabetes in their community. Thank you.
The article I wrote about was titled, The Homicide Rates Among Native Children, The Status Integration Hypothesis by Thomas Young and Lawrence French. In the article, the homicide rates for Native youths in areas covered under the IHS or Indian Health Services were calculated, as well as the percentage of people working in IHS-covered areas who the study considered to be female. The data was gathered by pulling from records provided by the IHS. One of the first things that the study showed was that females made up about 43% of the Native workforce in the area that the data comes from. But more importantly, and more relevantly, it was found that about 8 Native children were victims of homicide for every 100,000 people involved in the data, an abnormally high number considering the relatively small population of Natives in comparison to the rest. For reference, the average youth homicide rate in most places tends to fall around the range of 5. The leading theory for the abnormally high child homicide rate is that Natives still haven't been able to adapt to the environment of modern America, even after all these years. The ideals of the average white society continue to clash with the state of the average Native society, leading to the kind of social disorganization where child murder can happen more often than the average. This happens because Natives are expected to fit in with their neighboring societies, but aren't granted the same privilege required to do so, leaving them in a stressful state. Thank you.
Thank you. Okay, did your information give you any kind of solutions to this particular problem?
We all agree that it's the lack of resources that we are given as a Native society. Like PZ said, we aren't granted the same privileges.
Okay, good. What did Mike mention that the children K-12 built in the school to learn about diabetes? What was the activity that they did in one of the schools? A play. And so by writing and performing, the children are going to learn about what diabetes does in their community, okay? And it's one way to present data, okay? What else did you find for solutions? Anything else? Resources?
Changes,
Pardon?
lifestyle changes.
The lifestyle changes. And that's exercise, that's diet, it's sustainable egg and the produce, because I'm a veggie girl, I can't eat enough vegetables. But Then you also heard about tribal colleges and science-based learning, connecting with research universities. What does UND offer for natives? Yes, and so, and that's growing. I have friends who work there, and I know Dr. McDonald spent time at UND in the research part of InMed and health sciences, so good. All right, so there could be many good solutions here, and it could be a combination of them. But that's the criterion stage, and we're not spending a lot of time on it, but I kind of want to go through it with you so you understand that's what it is. Any questions from the audience? This is very well done, you guys.
If you haven't noticed, like we really didn't get a chance to discuss it, but all of our speeches actually fit perfectly with one another. And I thought that was pretty amazing.
And I think you read each other's work, and that's collaboration, and you learn from each other, which is one of the things about this assignment. Because I thought I wanted to do groups, and I know students avoid groups like the plague. But if there's a type A personality that gets that homework in, the others will read it to see what's going on, okay? And so I commend your group. I'm sorry Harry's not here because he did the work, but that happens sometimes in groups. So thank you.